Thank you, Madam Chair. I'm grateful for your leadership, as always, on this committee, as always, and honorable colleagues. Thank you so much, Chair Decker, colleagues, for hearing 3 bills that I filed with great House partners today. I just wanted to show up in person, and I'll be very brief because I know that you value hearing from constituents above all else, as do I, so I appreciate this. All of our, the whole constituency, the Commonwealth. So the first I just want to talk about is S1484 and H2432, an act to reduce incidence and death from pancreatic cancer. You know this bill, Chair Decker, you've reported it favorably. It has now been a prioritized bill of the Women's Caucus, for which I'm exceedingly grateful. And you know the stats from the American Cancer Network that there will be approximately 1,170 deaths from pancreatic cancer. So this bill sets up a comprehensive pancreatic cancer initiative within the Department of Public Health. So thank you for considering this. It is urged on by extraordinary colleagues and constituents. The second bill I'd like to testify in support of is S1483 and H2375. And this is an act relative to menstrual product ingredient disclosure. I filed this with Rep. Blay. I should acknowledge, and I didn't. I filed the pancreatic cancer with Rep. Kane, as you know, and Rep. Gentile. This bill was also, thank you, reported favorably, has been endorsed by the Women's Caucus, for which I am grateful. As you know, and as the committee knows, there's growing concern about chemical exposure and resulting reproductive health issues from certain components and additives in menstrual products. It's actually outrageous that we don't know the products that are contained, and I know you believe this too, in menstrual products. FDA is not going to protect us here. They haven't, and they certainly won't now. There are no guidelines that require that most manufacturers of menstrual products disclose their ingredients. And so we can have chemicals like PFAS as additives, and we know the health effects. So this bill requires ingredient disclosure on any menstrual product sold within the Commonwealth, following the lead of New York and California that have already done this. So we know it can be done. So thank you so much. And the third is S1482 and H2442, an act to protect patients and healthcare workers from exposure to surgical smoke. Now, you've also know this bill. You've also reported it favorably. Thank you. I'm grateful to the Massachusetts Nurses Association that I know has worked with you on this bill. It just requires all hospitals and freestanding ambulatory surgical facilities, there's been some confusion, but these are the 2 entities, to use smoke evacuation systems to protect hospital personnel. So again, thank you so much. These bills are important, and they're backed by such great constituents and our colleagues here in the State House.
Senator, thank you for your important advocacy, and we miss your leadership here on the committee, but we're so great to still have it in the Senate and the legislature.